Hey everyone, I hope you're all having a great morning. My name is Leah and I'm the Home Care Physiotherapy Clinical Lead at Empower Healthcare. I'm a DPT grad myself and I know how much time and effort goes into finishing this degree. So well done to all of you for making it this far. I remember graduating and feeling really lost and unsure of what I wanted to do next. So if you're feeling that way, I completely understand. Other than what I did during my hospital placements, I didn't know a lot about what it meant to be a community physio. So today I thought I'd give you a quick run through of what it means to work as a home care clinician and why it's something I highly recommend. So to begin, what is home care? Well, basically it's providing the care that an individual requires in the comfort of their own home. The goal is often to maximize a client's independence in order to improve their quality of life and ensure that their living environment is safe. Home care also includes sessions that are conducted at hydrotherapy pools, at local gyms, or even at a park close to your client's house. Many of our clients require ongoing input after their hospital discharge because they're unable to achieve all of their goals during their hospital rehab stay. And home care provides that ongoing care along the continuum to ensure that they're achieving their goals and not just the ones that are allowing them to be discharged from hospital. That's why I love home care so much. You get to see clients gain their independence back in the comfort of their own home so that they can get back to their hobbies and their passions. It could be something as simple as one of my clients who had a stroke and she was so happy when she was able to independently brush her hair again. Or another client I treated who had a below knee amputation, and after his home physio sessions, he was actually able to walk down to the shops independently. One of my favorite clients actually was someone who had experienced a lot of trauma and had been through some pretty significant abuse, so much so that it actually prevented her from leaving her house. But by combining her physiotherapy as well as her psychology services together, we were actually able to regain her confidence. And now she's living at home independently and she's actually returned to driving. And then you have situations like one of the clinicians in my team who had the privilege of rehabbing one of his clients so that he was actually able to walk his daughter down the aisle on her wedding day. Both these small and large wins make such a huge difference in people's lives. And it's the reason why a role as a home care clinician is so diverse and so exciting. So in terms of the clients you'll see, the diversity is huge. You'll be exposed to clients from all different age groups living with disabilities who have funding through the NDIS program. You'll see elderly clients who are receiving support through the home care packages. So they might have experienced strokes or Parkinson's or other disabilities. You have DVA clients, short-term rehab clients who are receiving Commonwealth home support systems. You'll have clients who are paying privately to support their own personal goals, as well as clients who are utilising the CDM program or the chronic disease management program, which you've probably heard of. It's available through your GPs. So in home care, not only are you going to see that wide array of clients and conditions, but you'll also see how the various funding systems work together so that an individual is supported. And it also gives you an opportunity to advocate for your clients to ensure that they're receiving the funds and the care that they need. It also means that you get to see your clients until you think or they think that they don't need services anymore. That was something I really struggled with while working in the hospital. I found it really difficult because I'd created these bonds with my patients and I knew the goals, I knew the things that they wanted to achieve, but we didn't have the opportunity to get there because they would be discharged from hospital before then. So that's something that you get to experience in home care. You get to see them get back to all of the things that they love. So alongside that wide variety of clients, you'll also be working closely with other members of the healthcare team. So the clients you see will often need assistance from occupational therapists, podiatrists, dietitians, nurses, all the different allied health workers. And it's super, super handy when the organisation that you're working for actually hires all these allied health professionals because it makes that collaborative approach much easier to organise. So in home care, not only will you be working with allied health team, you'll also be working alongside the client's GP, their case managers, support coordinators, their family, the next of kin, carers, everyone who's involved in supporting them to achieve their goal. It's really exciting to have access to such a wide variety of professionals, as well as people who are directly involved in the client's care and who are advocating for their client and wanting them to achieve all their goals. It really enables that holistic approach to the client's needs. I know a considerable concern for clinicians who are thinking about a role in community care is the lack of support and the access to a team environment. And it's definitely something you should be thinking about when you're applying for roles within the home care space. You really want to make sure that the organisation that you're applying to is able to support the things that you need. So make sure you're asking questions about whether you'll have a team leader. Will you have regularly scheduled meetings with your team? Will you have a mentor during your new grad year who you can call whenever you need support? Another question to ask is how the scheduling system works. So find out if you're going to need to be scheduling your diary yourself, which can be really time consuming, or if you'll be able to focus on seeing clients and that you'll have the support of an administration team. Super important aspect of the role, which definitely impacts how enjoyable community care actually is. Another question to ask is how much time you'll be given for documentation, as well as whether there are any KPIs that you need to meet, especially as a new grad. And the final thing I'd say, which is of the utmost importance, is whether they have a supportive new grad program with regular PDs and regular contact points with a learning and development coordinator. These things are essential for that optimal transition into a role as a community therapist. As someone who has gone through the process myself as a DPT new grad to a senior physio, I know how important these things are and how hard we've worked at Empower to ensure that this support is provided. And Empower was actually founded by a physio who worked for a bunch of different providers, and he actually decided to start Empower because he wanted to deliver the support that he felt was missing from his previous workplaces. Another important thing is progression within the workplace. So when you're looking for a role, make sure that the organisation you're applying to has room for progression if that's something that's important for you. And that might be in a leadership capacity, or that might be in a more clinical capacity. So for example, at Empower, we have multiple tiers of leadership to ensure the ideal support is available for all members of the team. So we have our mentors and our senior clinicians, then we have our team leaders for each region, and then the clinical leaders and the managers. And this multi-tiered support structure ensures that a clinician will always have someone that they can call to if they need support in any area, whether that's personal, clinical, or professional. But it also means that there's a lot of room for growth and progression within the organisation. So that's a basic summary of what it means to work as a home care clinician and the major things that you should look out for when you're applying for a role in this area. To finish up, I'd like to let you know about the new grad program at Empower. It's a program I'm super passionate about and a program we've slowly developed over the years with feedback from the new grads who have come on board. So we offer both a home care physio grad program as well as a RAC grad program, so it's residential aged care. So for us, the most important thing during a clinician's grad year is growth. We really want to ensure that your clinical skills continue to develop and that we're fostering your ability to work collaboratively within that home care team. So on the screen, you can see a picture of the new grad pathway. I'm just going to touch on a few points. So we offer a very comprehensive induction and orientation program. So at the start of each year, we bring all the grads together to welcome you and to introduce you to Empower. I know it can be a lot when you're trying to learn everything within your first week. So this is just a way to make sure your transition is not super overwhelming. We also offer a clinical development program. So each month you run through a different clinical topic with online learning, which is accessible through our internal learning management system, or LMS. At the end of each month, we then have a clinical workshop where we go through case studies and practice our hands-on skills. We also offer the mentoring program where you will be buddied with a senior clinician and they'll be your support person throughout the entirety of your grad year. So they'll spend time with you, they'll discuss clinical queries, any difficult clients you're experiencing, or just someone that you can bounce ideas off. You know, we really want our physios to be innovative, so that team collaboration is a huge must. And lastly, I just want to point out, we also offer an external PD fund of $1,500 for any extra courses or workshops that you'd like to attend, as well as 5 days of paid PD leave. So that's our new grad program in a nutshell. But on top of this, each department, so we have physio, OT, osteo, nursing, each department run their own monthly in-service. And this is actually hosted by the clinicians in the team. So all of our clinicians come from different clinical backgrounds with varying levels of experience. You know, some have been physios for over 20 years and others are like you and may have just started their physio journey. So these monthly in-services are a really great way to come together as a team, collaborate, go through caseloads, discuss interesting or difficult clinical scenarios and things like that. And all of these sessions are recorded and are available for everyone at Empower to review at a later time. Finally, every quarter, or that's every 3 months, the physio team will actually get together and hang out so that you really get to know each other. You know, your team is your support network. They're the people you turn to when you need guidance or help. So we really want to make sure that we're nourishing those relationships. In the past, our teams have gone to dinners, escape rooms, bowling, even karaoke to really get to know each other. You know, and sometimes we'll do additional PD sessions during these. So we've done the Dementia Australia for a virtual experience of what it's like to have dementia. We did a massive anatomy quiz at the Body Vital Anatomy Expo. And we've also attended equipment providers like Fisher Lane, who have given us a bit more information about the most up-to-date mobility devices. So that's just a little insight of Empower and our culture and our team. We are a family of clinicians and we'd love for you to come and join us if it's something that you see yourself as interested in. So if you have any questions regarding what it means in general to be a home care clinician, or if you think Empower might be the right place for you, please get in touch. You can send me an email or you can contact Lillian, who is our People and Culture Manager, via phone or email. Also, if you want to learn more, feel free to visit our website, follow us on any social media, and that'll really give you a good insight of who we are and what we're about. So that's all from me. Thank you so much for your time and best of luck in your final presentations. See you later.